Good afternoon, everybody. I really hope you're well. Happy Monday, if I haven't seen you already. Today's Women's Health Talk is all about brain fog. This doesn't actually just happen with women. It can happen with absolutely anyone. But we are starting our Fit Female project. Those of you that signed up, obviously you get my VIP group included. Or if you already paid for my VIP group, then you just literally added on the Fit Female difference. And as part of that, we are doing 4 health talks, one every week for the 4 weeks. You also have the Zoom calls with me. Obviously, they are separate and that won't be posted into this group. But this week, I really wanted to focus on brain fog because this is a lot of people's, one of their main symptoms with regards to their hormonal health that they find really does cause a hell of a lot of an impact with regards to their lives. So I want to talk about possible causes of brain fog and how you can hopefully try and eradicate it, or try and at least make those symptoms a little bit better. And I think if you are aware of what might be causing it, that might then also help you with actually making those symptoms better. No problem, Tan. And Amanda, good to see you as well. So what is brain fog? Well, it's not actually an official term. It's nothing. Bless you. Amanda just said, I call my son Matthew and his name is Michael. I remember when I was younger, my nan used to go through everyone's name in the family, literally everybody's name before she got to mine. She'd name all of her children, then all the grandchildren, and they'd be like, Nan, it's Kelly. It happens, it's not, the brain fog isn't an official term. It's not something that, you're going to actually get diagnosed with. But it's a symptom that can be caused by different things. And a lot of people don't realize what those things are. So first of all, it can be a change in hormonal balance. Stress can cause brain fog massively. Sleep changes and medication can also change it as well. And it can cause confusion, it can cause memory issues and lack of focus. People used to sort of take the mickey out of themselves, really. I remember, again, when I was younger, my aunties and uncles or my parents used to make little comments about the fact that, they'd walk into a room and forget completely what they'd walked in for. Couldn't remember why they'd walked into this room, what they were doing here, those kind of things. It causes essentially, like I said, memory problems with regards to, your cognitive health. So it's not an official medical condition, but it's like a symptom of other medical conditions, like I said, and it's cognitive dysfunction. So it can involve memory problems, lack of mental clarity, poor concentration, the inability to focus. So it doesn't have to be you forget things all the time or you can't remember what you were on about. Your brain doesn't have to just go completely to mush or completely blank. It might be the fact that your brain is just jumping around constantly. You've got this inability to stay focused on one thing and actually see it through. Some people describe it as mental fatigue. And I think that's a good way to describe it. Depending on the severity of the brain fog, it can interfere with your work. If you're at school, if you're at college, it can interfere with all of those things. It doesn't, however, have to be a permanent fixture. It can be managed. So let's go back and talk about why these things might cause brain fog. So there's several explanations as to why brain fog happens. Once you can identify the underlying cause, then you can hopefully work to fix the problem. So think about this with regards to your life. Maybe there are things going on that you wouldn't have normally related to your brain fog, and you might have just been putting your brain fog down to, it's just me going through the menopause, it's just my age. But actually, it might not. There might be some underlying things as well. Okay, so first of all, stress, the big one. Chronic stress can increase your blood pressure. It can weaken your immune system and trigger depression. It can also cause mental fatigue, because if you are constantly stressed and you've got this chronic stress that's constantly ticking away at you, it can be absolutely exhausting for your brain to constantly be thinking all the time. When your brain is tired and exhausted, it becomes harder to think, reason, and focus. So my first piece of kind of advice would be, is there any external stress going on that possibly could be managed? Maybe that stress can't be managed, but maybe if you are aware of why you're feeling the way you're feeling, it might then give you that sense of, actually, I know why this is happening. I've not gone crazy. It's not me deteriorating X, Y, Z. It's because I've got chronic stress going on because of X, Y, Z. And that's the reason why. It's not going to be permanent. It's not going to be forever. But obviously, the stress needs to be dealt with first. Because while you are still under that chronic stress, your brain fog isn't going to get completely solved, completely cured. There's ways in which you can get better, for sure. Lack of sleep. This can be, knock-on effect with regards to chronic stress. So poor sleep quality can interfere with how well your brain functions. So in an ideal world, we'd want to aim for 8 hours sleep per night, but I know that's not possible for a lot of people. Actually, with regards to sleep, it's not about what time you go to bed of a night, but it's what time you get up. And it's getting yourself into a sleep pattern where you get up at the same time or thereabouts every single day, whether it's a Monday or whether it's Saturday, that you actually get yourself into a healthy sleep program. And then your body will respond so much better, because you will know that you are kind of giving yourself the opportunity to be able to let your body know, okay, this is daylight hours, this is nighttime hours, this is when I'm supposed to be asleep and I'm going to sleep, this is where I'm supposed to be awake and I'm going to wake up. So it's that getting into that, habit of waking up at the same time every single day, not having to get up at whatever time it might be in the week and then sleep until 12, 1 in the afternoon on a weekend. God, I wish we could do that. But, most people who are adults have got responsibilities, which means that they can't. Most people have a lack of sleep, and that's the issue. But if you think about getting yourself into a healthy habit of trying to get up at the same time every day, that might also improve your cognitive health. Hormonal changes, and this is obviously part and parcel of what we're talking about with the Fit Female Project. This can cause brain fog. Levels of your hormones, progesterone and estrogen, especially, these can increase with regards to pregnancy or with regards to your monthly cycle. If you have a health condition that actually causes you to have higher estrogen or lower estrogen, then absolutely that can have a knock-on effect with regards to your brain fog. The change with regards to your hormones, especially these two, estrogen and progesterone, can affect your memory. And it can cause short-term cognitive impairment. So this is where you get the forgetting what you're on about halfway through a sentence, walking into a room, not remembering why you've walked in the room, talking to someone and then completely having a brain dump and not knowing what you're on about, that kind of thing. A drop in estrogen levels, which happens during the menopause, can cause forgetfulness, poor concentration, cloudy thinking. So again, I think it's, if you're aware of why that's happening, the fact that you've got this drop in your estrogen levels, okay, that happens during the menopause. I need to do things in order to be able to increase my estrogen levels so that my poor memory, my cloudy thinking, my lack of concentration, my forgetfulness actually gets better. Diet is a big thing. And this is one of the things that we're focusing on the Fit Female Project, about controlling the controllables. With hormonal health, sometimes you just can't control everything. You might be on a hormonal roller coaster and you feel like you're completely out of whack and you don't feel you're in control of you and your body. But what you can control is what you put into your body and what you do with your body, i.e. moving your body. So diet can be a real important factor with regards to hormone balance. So diet also plays a main role with regards to brain fog. Vitamin B12 supports healthy brain function. So if you struggle and you think, actually, I don't have a lot of vitamin B12 in my diet, then essentially a deficiency in it can cause brain fog. So one of the things that you could, first of all, is think about, maybe introducing more foods to your diet that help with regards to vitamin B12, or take a supplement that again is going to help it. If you have food allergies or sensitivities, brain fog also can happen. So eating certain foods, things like aspartame, which is an artificial sweetener, which again can cause lots and lots of nasties. It can be a carcinogenic, and it's also banned in America, not here in the UK, which is crazy. But people who have a lot of aspartame in their diet, it can be a cause of brain fog. Peanuts can also cause brain fog, and dairy for a lot of you, if you are sensitive to these things. So removing these trigger foods from your diet may really help to improve your symptoms. So maybe give that a go and see if that makes a difference for you. Definitely think about eliminating one at a time so you can see if they make a difference. Certain medications. So you may notice brain fog whilst taking medication. Again, if that happens, I would speak to your GP. Brain fog can be a known side effect of certain medications. It might mean that you need to lower your dosage of whatever it is, maybe change to a different drug, different medication, might help to improve your symptoms. With regards to chemotherapy, so if any of you have friends or family who are going through chemo, there is a term that's known as the chemo brain, which brain fog can happen after cancer treatment. And that's, again, very common and something to be aware of. Medical conditions associated with inflammation, fatigue, or changes in your blood glucose levels can lead to mental fatigue. For example, brain fog is a symptom of chronic fatigue syndrome, which obviously involves persistent fatigue, prolonged periods of time of being fatigued. People who have fibromyalgia may experience similar fogginess on a daily basis. Again, because of that medical condition, which is causing inflammation and a change in your glucose level and fatigue within your body. So, of course, you're going to have a knock-on effect with regards to your brain health. I think if then we think about managing those conditions as best we can with regards to diet, with regards to our hydration, with regards to our exercise, and then supplementation and medication, we are doing the very, very best we possibly can in order to help ourselves. Other conditions that can cause brain fog are things like anemia, depression, diabetes, migraines, Alzheimer's, things like that, autoimmune disease like lupus, arthritis, multiple sclerosis, viral infections like COVID, if you've had COVID, but also dehydration. And I spoke about this morning in the WhatsApp group. If you are dehydrated, your brain is made up pretty much all of water. So if you are dehydrated, then your brain is not going to be able to function properly. So you're already setting yourself up to fail. If you suffer with brain fog and you are dehydrated, it's like, what are you doing to yourself? You want to try and set yourself up to win, not to fail. So hydration can be a really easy thing to actually, help to prevent those symptoms. I think it's really important to always speak to clinical guidance and speak to your GP if this is something that is really, really affecting your life big term. There's no sort of a simple test that the doctor can do to diagnose it. It might be, like I said, a symptom of an underlying issue that potentially needs to be looked at. but also, you know, you might have other symptoms that are going on. So you need to be kind of open and honest with regards to your GP, and actually maybe get some blood work done, get some blood tests that might look at your liver, your kidney, your thyroid function, irregular glucose levels, nutritional deficiencies, infections, inflammatory diseases. And, you know, if you can get your blood work done and that kind of like has a little look and sees where everything is, that can then give you a bit of an insight as to what you've done. I got my blood work done a couple of months ago by Thriver. And because the GP wouldn't do my blood work, but I wanted to know what was going on. And actually, one thing that was highlighted when I had my blood work done was my thyroid is out of whack. And this particular test that was done, the cause of this can happen due to a viral infection. Well, the only viral infection I've had in the last 2 years is COVID that I had at Christmas. So the advice they gave me was to monitor my symptoms, monitor everything that's going on, make sure I'm eating a healthy, balanced diet with full variety, keep my hydration up, limit the amount of coffee I'm having, limit the amount of alcohol I'm having, see if I can balance that out. 3 months' time, have another test done and see whether or not that's still, you know, still out of whack. But generally, you know, your thyroid can get affected, like I said, by viral infections. And we just don't know that this might have happened because obviously COVID is a new thing. So again, be aware of that. But, you know, getting your blood work done is a really insightful thing to actually understand what's going on with regards to your body. There might be an allergy going on that you just don't realize about. So how could we manage our brain fog? Well, it depends on the cause, like I said. If you're anemic, you know, it might be that you need to increase the amount of iron in your diet. You need to increase your green leafy veg, or possibly take a supplementation if you can't get in enough of that from a food source. You know, maybe you're diagnosed with an autoimmune disease and you might need medication for that to be able to, you know, reduce the inflammation or suppress what's happening there. But sometimes, you know, relieving brain fog is just a matter of correcting a nutritional deficiency, switching medication, or improving the quality of your sleep or your life with regards to your stress. So kind of a little bit of home remedy that you could focus on. Making sure you're getting yourself into a sleep pattern, and as best you can, getting good quality sleep for you, whether that's that you know, thrive on 6 hours, whether you thrive on 9 hours, whatever it might be. But get into the habit of getting up at the same time, thereabouts, every single day. Put yourself into a sleep pattern. Managing your stress by understanding and knowing your limitations. Avoid excess alcohol or excess caffeine to try and combat that stress, and look at, you know, maybe focusing on going for walks or doing some breath work, meditation, yoga, Pilates, you know, focusing on managing that stress a little bit better. Exercise can massively help with regards to cognitive health, because when you're exercising, you're increasing the amount of blood flow through the body. We're increasing serotonin within the body, dopamine. All of these things help with regards to your mental clarity, and especially if that exercise actually is quite cognitive. So things where you're going to, you know, learn choreography, or you're having to think about what you're doing. Strengthening your thinking abilities by maybe doing things like volunteering or solving brain quizzes. I know some people do those kind of things. Finding something really enjoyable, an activity, something for you. I'm actually going tonight for my very first tap lesson since I was at school. I'm going back to tap and I can't wait. I'm so excited about going. I'm really looking forward to it. It's something for me, nothing related to my business. And no one's going to know that, you know, I'm an instructor there. I'm really, really looking forward to it. It's going to be great for my mental health. It's going to be great for my cognitive health. It's going to be great for my well-being. Finding something for you that you can do for you that's, you know, not something that you have to do, but something you want to do and you really, really enjoy it. It doesn't have to be physical. It could be drawing, it could be painting, it could be gardening, it could be writing, reading, whatever it might be. And then also really think about your diet. Think about your hydration. Increasing your intake of good quality protein, fruit and vegetables, healthy fats, good quality carbohydrate is going to be absolutely key, okay? Like I said, it can be really frustrating, but relief is possible, and you shouldn't ignore the symptoms, because if it's left untreated, it can impact the quality of your life and it will get worse. So once you know what the underlying cause is, it can be addressed, and then your mental clarity can massively improve. I really hope that was helpful. I hope that was beneficial. I hope you found that quite interesting. Please let me know, as always, any questions. And if you are new to the group, or even if you're not new to the group, but you maybe haven't looked under topics, under the hashtag Women's Health Talks, I have done so many, hundreds of women health talks about all different things, which you can watch and you can look back over anytime that you want to, that hopefully will give you a bit of an insight into maybe what's going on with you and how to balance those things out. Thank you so much for joining me. I'm going to be live at 12:30, gang, and I'm going to be doing our spine-safe abdominal training. So if you struggle with regards to your back, but you still want to work your abs, this is key for you. Thank you so much. Have a great day, everyone. Take care, and I will see you soon.